Hey again, so here's a little video for third practical. I hope it helps. So first of all, I'm gonna start with removing my rings and my anything that I have on my wrist, like bracelets, watches, anything. Now go ahead and wash my hands. I'll set up my sterile field base. Always make sure you touch only the outside with your clean hands. You have a sterile field border, which is 1 inch from the edge, and anything above it till your face level. So you shouldn't be leaning or throwing anything directly on top of it. The packages, you open them, only touch the outside, don't touch the inside contents, and try to drop them from the outside of the sterile field. Now I set up my saline, my little container with saline inside. Also, if anything falls or drops below your waist level, do not try to salvage it, just let it go and get a replacement. Then I'll go ahead and set up my pieces of tape so I don't have to handle it with gloves. I'm gonna do around 2 to 3 regular tapes, and the last one is gonna have my name and the date on it. So now I'll cover my sterile field and I'll set up my patient. Again, I only touch the outside of the towel. Here's the patient. Okay, so at this point, I'll go prepare the scissors to cut off the bandage. Now you wash your hands, and then I'll go ahead and glove up. Just a regular natural glove is fine. Okay, now we can go ahead and remove the bandages. Make sure you don't cut on top of the wound. Throw it in the trash. And remove whatever contents are. And now you say that you're gonna clean the wound. You don't have to actually physically do it. And then you cover your patient again to preserve the temperature. Okay, so now we're gonna remove our gloves. Make sure you only touch the outside with the outside of the glove because that's dirty. And you only touch the inside of the glove with your clean hands. Throw them in the trash, and now it's time to don. And so you go ahead and wash your hands. Open up the package carefully. Make sure you only touch the inside of the gown. Okay, over here, since your hand is inside the gown, you can pull the sleeve. Now you only want to pull the sleeve up to about knuckle level, not any higher than that. It's going to make it easier for you to glove up, but also to doff, as you will see later in the video. And we want to make a seal so there's no contaminants going inside our body. Now we reach out for neck strings. And we carefully get the middle strings. Try not to rub off your sleeves with anything. And now we're gonna put our mask on. You go for the earlobes first, and then you pull down under your chin, and you make sure you press the little metal piece on the nose to make a seal over it. You put your little goggles or face shield, and now it's time to glove up. So you open up the package, remove the contents. Okay, so now make sure you set up with the right side towards your right side and the left towards your left. There's two big letters there. So you open up from that little fold in the middle. Okay, you gotta make sure the package doesn't fold on itself here, and fold the bottom so it stays open. So you grab the first glove from the little folded cuff. You only touch the inside of the glove with your bare hand, okay? You pull it all the way up, only as far as you can. But you try to put it over the sleeve. And now with the gloved hand, we're only gonna attach the outside of the glove, so outside of that little cuff. Okay, so we're gonna pull on our other hand. All right, so now that both hands are gloved up, we can fix whatever it's little hanging loose or wrinkly, since both hands are sterile. So we go ahead and open our sterile field back up. Try to open it from the inside because that's the clean part. And we're gonna open up our patient too. So we're gonna use our right hand, or the one that's closer to the sterile field, to drop the materials into our hand or left hand, and we're gonna use the left hand to pack the wound. And then you continue to pack the wound like that, passing materials from right hand to left hand. And now I don't have a wound with me to show you, but make sure you pack the wound edge to edge and the surface is leveled. And now it's time to bandage. So you want to bandage the roll away from the body, or the body part, and in an eighth pattern. Okay, make sure it's not too tight here. And now it's time to tape. Now this is a thin strip of gauze that we're using, so I'm only going to grab two pieces of tape for this, and the last piece of tape is going to have your name and date on it. Okay, so now our patient is all set up. It's time for you to doff. So first we're going to pull up our neck strings, pull our waist strings, and now we're going to pull our glove cuff with the gown together so we're not contaminating our hands. And then from the inside of the gown you do the other hand, and then you just roll everything out from your body. Try not to shake anything, try not to touch the outside, and this goes on the trash. Now you remove your little goggles on the trash also. Now, you may or may not leave the patient's room for this, but you're going to go ahead and take off your respirator, go ahead and wash your hands one more time, and you're done.